Welcome to Sonoma County Wildlife Rescue. I'm Dr. Dan Famini, the veterinarian for the facility, and excited to show you some of the patient stories and our facilities here where we help animals recover and grow to return to the wild. Today I'm going to show you a very different setup for our wildlife enclosures. Now, most of the areas are going to be as naturalistic as possible to encourage as many natural behaviors as our patients regain the capacity and develop the skills they need to survive in the wild. Behind this area here is a specialized location that we use for very individual concerns. This is our isolation area. The enclosures in this location, our isolation row, are going to be specialized in that they have an easily disinfectable surface. And so instead of using all the natural materials we typically utilize to train our patients and help them develop the skills they need to survive in the wild, this is going to be an area where we'll keep animals that were concerned for disease outbreak or whose nature of their injuries are such that they're worried about infection if they're on a standard substrate. The most common infectious disease concern that we have amongst animals coming through Sonoma County Wildlife Rescue is distemper virus. And so distemper is a catastrophic infectious disease that can cause neurologic damage, respiratory damage, integument skin damage, and it can be transmitted across a number of different species. We see it in raccoons, we see it in skunks, we see it in foxes, etc. And so if we have an animal that's a suspect that it may be harboring distemper, this is the kind of area where we'd keep those animals. And so in our isolation runs, these are going to be built upon a cement substrate, which is something that we can easily disinfect. And so combination of dilute bleach and sunlight is one of the most powerful methods to disinfect against a wide variety of pathogens, but we have other chemicals that we can use if need be. And so this area we can feel secure and safe that we can utilize again and again, even if there was an animal that could have been harboring a transmissible condition, because we can truly and fully disinfect this location. Once we're sure that an animal is clear of any risk of spread of such a disease, then they can be transitioned to the more naturalistic enclosures as they head towards release for the wild. The other reason that we'll keep animals in our isolation ward would be the same reason why we have these 2 raccoons in a couple of them right now. The 2 raccoons we currently have healing in different isolation enclosures here at Sonoma County Wildlife Rescue both came in with pretty severe trauma, pretty severe physical damage to their tissues. One of them was definitely caused by a man-made issue. The other was caused by a natural issue. The snare and handhold traps that some people have utilized to capture raccoons are explicitly illegal in California and have been for decades. Yet, unfortunately, we still do see animals come in under the trauma of these kinds of entrapment devices. And so there was one raccoon where its entire hand was mangled from being in such a trap, plus it was missing parts of its digits on other paws from trying to escape from it. It needed significant surgical debridement of the paws, but they are capable of healing as long as they can stay clean and clear during this phase. And so we use our isolation enclosures as a means to keep them on a clean surface, but still allow them to experience the weather of the outside in a safe, managed environment while that skin heals up. The other raccoon that came here had severe damage to its back from either a domestic dog or perhaps a larger, more adult raccoon attack. And so that individual also had widespread damage, widespread infection. And so while we have cleaned that up and set it up so that it is capable of healing, during this critical phase, while that skin is not yet fully intact, we need to keep it in a clean environment, such as our isolation enclosures. For animals held in our isolation area, whether it be due to trauma or due to infection, we have to make sure that we're not going to bring any infectious organisms into them or from them towards the rest of our wildlife community. And so we always have to have a separate set of equipment for our isolation patients. And so this is the shed where we keep the most handy supplies we need readily available for treating our isolation area. Depending on the nature of the infection concern, we'll utilize a variety of techniques. Of course, everything that can go in can come out. We also will have foot baths and different protocols for what kind of apparel the folks providing the animal care have to utilize, just to make sure that we can keep these patients from getting infected and from spreading any disease that they may harbor. After the animals graduate from this phase, then we get to move them on to our normal wildlife enclosures. And then, of course, the ultimate goal is to get them released back into the wild as healthy, robust members of the wildlife population.